G'day guys, it's Alex from ACL Survival Club. In this video, I'll take you through a start to finish hydrotherapy session split into two parts. The first part, we're going through our normal hydrotherapy exercises in detail, and then we're going through our return to run hydrotherapy session. This video is appropriate for you if you are 3 weeks post-op all the way up till 12 weeks post-op. Hydrotherapy is brilliant for people that have undergone ACL surgery. It is great for getting the knee moving. It's great for getting the rest of the body moving as well. You just can't do it before 2 weeks. It takes about 2 weeks for those wounds to heal because we want to reduce that risk of infection. The session that we'll be going through today will be completed by Charlie, who's undergoing her ACL rehabilitation. She's using her hydro-occluded shorts. Occlusion can be done underwater. She's using a low level of occlusion, and this session will take about 30 minutes. So jumping into the pool, we've got Charlie there in her hydro shorts. She's ready to get started. So we're going to begin with 50 bodyweight squats at about chest height water. Charlie, because she doesn't have any meniscus pathology, is going to try to squat at 90 degrees or below to get as much quad activation as possible. Because as she gets lower in the water, there is less weight, she's able to get a bit deeper and get as much range of motion as possible. From here, we do 25 single leg calf raises on each side, trying to get up onto that big toe as much as possible, getting as much activation of that calf as we can. Try to be fairly slow with these. We don't want to bounce, we want to be slow and controlled with the movement. This is actually a lot harder than it looks. You can use the side of the pool to stabilize yourself as well. We then have our hip abduction, adduction exercises. This is great for developing strength around the groin and the lateral hip. By doing this faster, we get more resistance in the water. So I tried to do these a bit faster with Charlie, really snapping shut and opening her legs quickly. This really loads up the adductors and the abductors of the hip. Key points here is just try to keep the knees straight. Don't let your knee bend. We want to be doing this fairly quickly, and we're doing 25 reps on either side. Up next, we've got single leg squats. We're doing 25 reps per side. Single leg control is one of the most important things in ACL rehabilitation. We want to develop good motor control of that affected leg. Motor control is just coordination, control, the ability to control what your body is doing. By being in the pool, we can do more reps. By doing more reps, we'll develop better control because it's just a numbers game. We just need to develop that efficiency with doing the exercise. So by being in the pool, we can load up without too much weight going through the leg. As you can see here on her right leg, she's getting good control and decent depth, trying to get down to 90 degrees. As she gets lower, she's got less weight going through the knee, so she can get really good practice. This will still give you a pretty decent quad burn, especially with the amount of reps that she'll be doing, as we're doing 4 rounds of all these exercises. From here, she gets a little break doing a double leg Soleus raise for 50 reps. This can also be done as a single leg exercise. Bent knee calf raises target the Soleus more so than the Gastroc, so it's a great variation to chuck in during your hydrotherapy sessions. There are no issues here with holding onto the side of the pool. Try to keep the knees bent and driving straight up through your big toe, trying to get as high up onto the big toe as possible. Next up, we've got reverse lunges for 25 reps per side. This is once again a coordination exercise. Like a single leg squat, we're working on the control of the foot and the hip as well as the knee. This will allow us to get good control, getting that knee to go over the big toe. We don't want the knee to go inside the big toe. Ideally, we are keeping ourselves in good alignment, stepping back in chest height water. Once again, because we're in chest height water, she'll be able to get lower, getting towards 90 degrees at the knee. By getting lower in the water, she will weigh less and makes the exercise easier, and you get more range of motion through the joint. Finally, the best exercise in this is the lateral side-to-side lunge, also called a Cossack squat. This allows Charlie to get side to side and really squat down and trying to find that extra range. It's also a really smooth pattern. You can see at the start there, Charlie's a little bit shallow, but as she really gets into this exercise across the 50 reps, she really gets down below 90 degrees. Now, once again, if you've had a meniscus issue, and the surgeon has said don't go below 90 degrees for the first 6 weeks, especially if you've had a meniscus repair. You probably shouldn't be doing these exercises anyway, as you should be non-weight bearing. If you've had a meniscectomy, you probably need to wait to at least 4 weeks before you start doing this exercise. But this is a great way to start loading up your knees, getting good load through the quads, but also getting the knee moving. So because Charlie is now 8 weeks post-op, we're doing her run prep. She's going to hopefully run at 16 weeks. So we've got 8 weeks to try and drill her in the pool and get her ready to do plyos at about 12 to 14 weeks. A walks is where we're driving down into the ground slowly. We can then progress to a march, which is a slightly more aggressive drive down into the floor. both of these exercises, we're trying to keep the knee straight and achieve triple extension. From here, we can go into a skip, which is when we're switching halfway through the movement. So you can see we've got both feet switching next to each other in the air, and then we can then turn this into a run, where we're now switching a bit more forcefully, driving down into the ground, keeping a nice stiff ankle, but also achieving triple extension, which is when the hips, knees, and ankles are straight in alignment. This is a great exercise to work on good run mechanics, working on that motor control, and just simulating what we would be doing on land without any of the negative effects of loading through that knee. We've also then got B walks for coordination. This is a very challenging exercise to do. This is a running mechanics drill that many sprinters will use, but it's just great for general coordination of the lower limb. Then moving on to our pliers, we've got our double leg stiff-legged pogos for 50 reps. We're trying to keep our heel off the ground and getting up as high as we can, but also keeping our knees straight. This means the ankle has to work really hard. If our ankle's displaced, meaning that our heel slams into the ground, we are not absorbing force as well as we can, and that is the purpose of these drills, is to try to make sure that we keep a stiff ankle and stiff knee. We can also do this as an exercise with a bent knee as well, which is just a different variation. We want to be able to jump with a stiff knee as well as a bent knee. So working on both variations is important and can be done as part of your hydrotherapy rehab. So much of jumping and plyometrics is coordination. So by being in the pool and doing your early single leg work in the water, you can do it at a fraction of your own body weight, which can really help to drill the correct technique and just to train the brain to know what position everything needs to be and to jump efficiently. Hydrotherapy is brilliant for drilling motor control, which is just the coordination of our body. So really make sure you get stuck into this as part of your rehab. So here's the full session for the first part of the rehab, and here is the second part of the rehab. I really hope you enjoyed that video, guys. Hopefully it's provided some context and framework for your next hydrotherapy session. If you have any other questions, please be sure to drop them in the comments below, and we'll be sure to see you in the next video. Bye for now.